to our first CPNG quarterly webinar for 2022, Caring During COVID. How is COVID impacting you and your patients? And in case you did not know, the CPNG membership covers all domains of navigation. And the topic for our webinar today, Caring During COVID, actually came as the result of CPNG members. So we want to encourage all CPNG members to send us suggestions for future webinars. At the end of the webinar, you'll receive an email with an evaluation link so that you can complete an evaluation and get your certificate of attendance and your contact hour. So our speakers for today are Amy Hoke, she's the patient navigator with Dr. Quinones. Penny Daugherty is the nurse navigator at Northside Hospital, and Ines Hoster is a Healing Touch certified practitioner and instructor, and none of our speakers have anything to disclose. The format today is we're going to let the speakers each speak for about 10 minutes on their area, and then we're going to have breakout sessions for participants to continue to discuss and to network with each other, and then we'll be coming back together to share at the end and for questions. Because of the increasing demands in oncology affecting navigator stress and coping, we'll be discussing how COVID is impacting you and your patients. And with learning therapeutic questions to elicit sharing, we want to support a caring and a healing environment. And finally, learning stress reduction methods to help lift your mood and promote self-care. So our first speaker today is Amy Hoke, and I'll let Amy take it over.
Thank you so much. As Cindy just said, I'm Amy Hoke, and I'm a patient navigator for Dr. Michael Quinones. He's a surgical oncologist. And my perspective probably will be a little bit different than some of yours. I know a lot of you are nurse navigators working in a hospital setting. So some of what I say may relate to you and it may not, but that's what we're going to discuss as we get further in into this. Can you advance to the next slide for me? So how as a navigator do we handle, or do you handle the following? And I just put down a couple of things that I know that I experience and that my patients are experiencing, and that's delays in treatment, delays in surgery, and then the patient's concern over getting COVID while battling cancer. So with the first one, delays in treatment, I think that we all know that we're seeing that patients that would have gotten yearly screening, mammograms, colonoscopies, those kind of things, have not done it the way that they did in the past. They've put it off. They're afraid to come in. They, have waited 2 years, till they felt like it was safe, or they tried to make an appointment and maybe they couldn't get an appointment for, 4 or 5 months because suddenly the breast centers were only doing 10 mammograms a day instead of doing 20 or 30 because we had limited the amount of time, or we were trying to stretch out the time for each patient, and we didn't want a lot of patients sitting there together. So that has caused some concern because we feel like it's possible, even though we know that it'll probably be years down the road before we're able to do any kind of randomized trials, but is that affecting the time that we diagnose the patients? Like if we'd seen them 2 years ago when they first felt a lump, would they have been a stage 1? And now they're coming in and they're a stage 2 or 3. So we don't know yet if that's the case, but we do know that patients are putting off a lot of the things that they would have done normally, and that's causing delays in their treatment. We personally, and you may not be seeing this as nurse navigators in the hospital, but we're seeing delays in surgery. Our patients are canceling because either they have COVID or we had a situation here where we use an outpatient surgery center, and almost all of the anesthesiologists got COVID. And so suddenly we're getting calls saying, you've got to reschedule your days and you've got to move these patients off. And you can imagine the anxiety that caused the cancer patients, that suddenly a surgery they thought they were having in 1 week to take out their lump. And we all know that once someone's been diagnosed with cancer, they want it out now, or they want to begin treatment now. And I think that that's something we can all relate to. And we would probably feel the same way if we were in that situation. So having to suddenly tell patients that we're going to have to delay their surgery has raised their anxiety. And I think it puts a little bit more, I wouldn't say anxiety, but it puts a little bit more maybe pressure on a navigator. And we all know that we have to deal with our own anxieties and we have to take care of ourselves or we can't take care of the patients. And so, because, you know, they're scared, and so we're having to deal with them maybe a little more often. And I think that leads into the last thing that, and then I'll kind of talk about all of it, but they're concerned they're going to get COVID while they're battling cancer. We know that if they're in chemotherapy, that their immune system is weakened. And we all know that even people that have received their COVID vaccinations are still getting COVID. So a lot of patients call me and say, you know, I've got 102 fever, I'm getting chemo. Do I call my oncologist? What, you know, do I get checked for COVID? You know, they're not sure what's going on, and they have a lot of fear that, and they're more fearful even than probably the normal person about being around anyone else. And isolation certainly doesn't help you when you're going through cancer. The more support you have, usually the better you do. Or at least that's been my experience with my patients. So for me personally, I'm finding that throughout this COVID pandemic, the patients are more anxious overall, and that I am doing a lot more hand holding, which that's fun, but the patients are needing that. A patient that would have called me maybe 1 or 2 times before their surgery to talk to me about their diagnosis or to talk to me about the stress level they're feeling, suddenly out there calling me 4 or 5 times before their surgery or even after their surgery to just, you know, express the fears that they're having. So more calls are fine, but I think that it does raise, or it causes the patient navigator to have a little bit more to do, and then maybe we're not taking care of ourselves the way we should. So in short, I do think that COVID has raised anxiety in our patients and possibly added more stress to us. And I'm going to turn it now over to Penny, and she's going to present, here we go, how we can talk to our patients.
Hi, everybody. My name is Penny Doherty, and I'm a GYN oncology nurse navigator at Northside Hospital. And for a while, I was the substitute navigator for head and neck, which was a very intense moment because those patients are just as intense as my gynecologic oncology patients. And the biggest thing that we have going for ourselves to offer our patients is to talk to them, about anything they want to talk about because they're so full of anxiety. You know, as Amy said, it's very scary. And I just heard on the news this morning that people are coming in with stage 4 breast cancers because they've been afraid to show their face at the emergency room for 2 years or come to the doctor or be around people. And this is the normal anxiety that people feel is augmented by the fact that they're afraid they're going to get COVID and die. So they can't really decide which is worse at this point. So our patients have truly lost their way in being thinking human beings because somebody said to them, "You have cancer." And as soon as somebody says that, you can see little Charlie Brown down there going wah, 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 wah. And sometimes that's all patients hear. I have actually done 2 hours worth of information giving to patients in their room with their family members and have them tell the doctor that they never saw the navigator. And then I'll come in and they go, oh yes, I remember you, because you've totally fractured every construct they have by saying you have cancer. And in gynecologic cancers, you have a lot of people telling people how they knew somebody who maybe had 2 good years with ovarian cancer. It's always very helpful. And that sort of shoots everybody's brain cells into oblivion. And the patient really and truly, as that sign says, has no idea where they are. They don't know who they are. They were Penny one day, and the next day they're the one with ovarian cancer. You know, and all of a sudden their family's touching them like they either have cancer cooties or they don't know what to do with them. So this is our moment to really validate who we are. It's our opportunity to be a guide for our patients and help them walk their way back to a sense of who they are, that they're a person and there are other things in their life besides cancer. And we have to help them think beyond that or aside of that. So because of that, we have to choose our words very carefully, because I have had patients who will quote one of the doctors I used to work with. He's retired now, but she would quote Dr. Benigno from 2011 and say to me, and he moved his finger like this. And he was very upset about that. And they're remembering this because at that moment, their doctors are their lifelines, and we also can be their lifelines. All of us can be. So it's nice to have a script. When I was in nursing school, I resented scripts. I don't know how old y'all are, but I went to school in the 70s and we had IPRs, or interpersonal relationships. And one of my instructors was a psych instructor from Bellevue in New York, where they have quite a few profoundly psychiatric patients. And one of the things that she said was to say to a patient was, uh-huh. And I said, Marianne, nobody would say that. And she said, she smiled. And she said, as you become a nurse and spend your years being a nurse, every time you say that, you will think of me. And I have, and I have. And I've used a lot. Things that you want to do with your family members, with your patients, is give them an opportunity to speak. And I have to say this right up front. This was given, these scripts were given to me and many of us at AONN, which is a navigation conference, which we should all think about joining. And we are, as CPNG, we are a local affiliate, so just remember that. But you want to give people words to speak back to you. Lily Shockney, if any of you know her, is an amazing communicator. And when I have used her script, which I actually have taped to my wall, lest I forget it, I'm amazed at how much information. First of all, sit down. Don't talk to a patient when you're looking down at them. That's extremely and profoundly annoying. Sit down. Ask, can I sit down? Can we talk? That's always a big thing to say to a patient because it gives them control. They're in a horrible room with, not great food, in a stupid gown, and they're miserable. And asking a patient permission is to say, this is your space. It's important. How much do you know about your cancer? And shut up. Just wait. See what they say. Because they may not know anything and they may think it's a different cancer, especially in gynecologic cancers. And I think in many of the cancers, like in breast, you can have triple negative breast, or you could have, HER2 positive. Each of them is a totally different scenario, and you want to know what they know, because we are dealing with Dr. Google, who tells everybody everything. And when the patient answers you, you can ask them, how much do you want to know about your cancer or COVID? COVID is very scary. Nobody knows anything except the words COVID, Omicron, Delta. They have no idea what they're talking about. I don't really know that much about what I'm talking about. I just got my shots. But in patients, this is profoundly terrifying because they're immunocompromised and they know it, and they've already been cautioned to not eat this, not eat raw foods, not do this, not, wear the mask. So now they're totally terrified that they could die from COVID. And you ask the patient, what are you most worried about? You'll be amazed. You'll be totally amazed. I had somebody say to me, they were worried, terrified, worried, sick to their stomach about this, who would take care of their dog if they died. You don't know what's in somebody's head. It's helpful to know that. And with that comes, what are you hoping for? Hoping, and just let them answer. Because somebody or several well-meaning people have already told them the wrong thing, And to come back to a positive place with the patient, let me ask you something. Please tell me the 3 things that brought you a lot of joy before all this. You will be totally flabbergasted. And what you can offer patients in that conversation for some of those things that brought them joy is the promise that they will be engaging in those things and that they will have joy in those things after what they're going through, after their treatment is done. And ask people, what brings you joy in general? It's amazing because people will say that. And interestingly enough, Lily Shockney, when she gives this talk, tells the story of her father, who was a farmer. And he was extremely angry because he had cancer, and he was a farmer, so he's used to being in charge of his crops. And the nurse practitioner who spoke to him, the palliative nurse practitioner, said, what are you hoping for? And what he said is, I want to get back on my combine. And through a series of events, this particular nurse practitioner got Lily's dad back on the combine. He didn't do much, but he was there, feeling the wheel, feeling like he was a farmer. And that did bring him back to a positive place. That did bring him joy. Some of the things that bring people joy are as simple as iced tea. Just hearing the sun, dry the flower dew. You don't know that, but it's important for you to know that because you can guide the patients back to those things. And it's always nice to have a script to help the patients reconnect with themselves. And there's another really good component to that. And I'm going to introduce you to Inez, who is going to talk to you about that. And we have some beautiful information. So Inez, would you help us out, please?
Well, thank you, Penny. So I'm Inez Hoster, and I'm a patient navigator. I'm a healing touch practitioner, certified instructor, and I see clients, we call them clients, who come to my practice, and I help them to calm them down before the operation and help them with anxieties, and then also help them after the operation to help and support the healing process. So what's really, really important, I think, as nurse navigators is that we practice a lot of self-care. And there are 3 different kinds of things that I want to teach you today. You may be familiar with some of this. And just take a moment and think about how, on a scale of 0 to 10, how relaxed or grounded you feel right now. When you choose a 10, that would be, I feel totally grounded, totally relaxed. And then everything down from there would be, oh, I need a lot more of that. So one thing that we all have available to us is our breathing tool. And no matter what, it helps us can get centered and feeling safe. And there are many different forms of breathing, and I will guide you now in a 4 to 8 breath. That means that we breathe in deeply. Diaphragmatic breathing is wonderful. We breathe in deeply to the count of 4, and we exhale slowly to the count of 8. So I will do this now for you, and we'll do this 5 times. So if you would, please have your feet on the floor, feel connected with the floor. You may want to close your eyes if you feel comfortable. That is up to you. And feel the support of the chair that you are on, maybe also the support of the back of the chair. And now I begin to count. 1, 2, 3, 4. 1, 2, 3, 4, 5, 6, 7, 8. In, 2, 3, 4. Out, 2, 3, 4, 5, 6, 7, 8. In, 2, 3, 4. Out, 2, 3, 4, 5, 6, 7, 8. In, 2, 3, 4. Out, 2, 3, 4, 5, 6, 7, 8. Last one. 1, 2, 3, 4. 1, 2, 3, 4, 5, 6, 7, 8. So this did not even take more than 2 minutes, and everybody has time to do some deep breathing and just notice and check in with yourself how you feel right now. And would you give me the next slide, Cindy, please? So the next tool I want to give you is visualization. Some people are better at visualizing than other people. But again, we want to experience a feeling of being grounded, centered, calm, and safe. And I'm going to guide you through what we call the tree meditation. All of you, I am sure, have seen trees. You may even have a favorite tree. And so as you are now allowing me to guide you, you may want to visualize a particular tree and that you sort of become that tree. So just take in a few deep breaths and visualize yourself being either that particular tree that you love or just any kind of tree. And think about your feet and have in your imagination grow roots out of your feet and sink them through the floor that you're having your feet on now. Just sink them all the way down through the building into the ground. And spread these roots very wide and deep. And get in touch with that wonderful, calming, soothing earth energy. And now in your mind, you're allowing that earth energy to come up to you just like we have it now. In spring, the sap is rising, and allow that earth energy to flow up those roots into your feet, up to your knees, up into your hips, into your whole body, and into your arms and hands, and into your head. And now imagine that you're growing branches out of the top of your head, and they're growing further and further through the ceiling, through the building that you're in, and just reach out, and all this wonderful sunshine is coming into you. And you're allowing that universal energy to flow into you and mingle with the earth's energy. And feel how strongly you're connected with the earth and with the universe. And allow yourself to sense those wonderful calming energies flowing through you. And now, if you will, gently in your mind, come back and feel the chair that you're sitting on. And wiggle your toes and your fingers, your hands, and come back. And just check in with yourself on that scale of 0 to 10, where you are now with regard to feeling relaxed, feeling calm. And the last tool that I want to give you is also part of imagination, but I want to work with you on getting in touch with your ventral vagus nerve. And that is the one that allows us to be calm and to also actually then help our clients, our patients, to co-regulate so that they can become calm as well. The calmer we can be, the calmer they can be. And as you well know, the sympathetic nervous system is the one that has us in flight or in fight, and it is the ventral vagus nerve that gets us to feeling calm, relaxed, and safe. So in your mind, think about your kidneys. Your kidneys are holding a lot of fear. So we want to soothe those kidneys, either our own, or we can help our clients to do the same thing. So just imagine, and you can do it either physically or by imagination. If you can, bring your hands over to the back where you can feel your kidneys. And just breathe calmly and try to send loving kindness to each kidney. If it is difficult for you to reach that place on your body, you could also try to reach them by putting your hands on the front of your body and thereby imagining that you are getting in touch with the kidneys, but from the front. And just breathe. And now we want to bring more attention to each kidney. So have one hand on the front of your body and the other one in the back on the left side. And if you will, if that is not comfortable for you, you could also imagine that you're holding that left kidney in the palm of your hand and you're putting your other hand on top. And just imagine that you're holding your kidney in a very soothing way. And if that's comfortable for you, you may even want to bring your hand and gently, ever so gently, move your hand over the hand that is holding the kidney. But you can also just hold it still. Or if you can, hold the kidney in the front and the back. And breathe. Breath is your friend. And now we're going to do the same thing to the right kidney. So either hold your left hand in front of the body and the right hand goes to the back of the kidney, or you're imagining holding your kidney in between your hands. And just send loving kindness to your right kidney. And breathe. And if you want to, if you like soothing that kidney, just calming it, just like you would with a baby. Calming that baby, calming that kidney. Okay. So, and we're going to come to the end of these 3 little tools. And I just want to check, have you check in now and give us an idea of how far you have come up on that scale of feeling relaxed, feeling calm. Are you closer to a 10 than you were earlier? These are 3 little tools that you can very easily do, and it doesn't take much time. And I so appreciate your being here. Thank you.
Thank you, Ines. I'm very relaxed myself after that. I think a lot of it is your voice. That helps. But right now, we're going to be going into breakout sessions. I'm going to stop sharing my screen in a minute, but we're going to be going into breakout sessions. And what the goal here is, I'm going to try to get each presenter into a breakout session so that they can help facilitate the conversation. But what we want you to do is discuss how COVID has impacted you and how COVID has impacted your patients in one area of practice or self-change that you can share related to improving wellness. And so it might be imagery, it might be, therapeutic breathing skills. It might be something as simple as making pine cone bird feeders. I mean, whatever helps you to feel better, share. And if you can choose one person from your group, or if maybe the presenters can be that person to come back and share when we're done with the breakout sessions, then we'll do that for about 10 minutes, and then we'll come back together and share and have any questions at that time. So Katrina, can you help me with the breakout session? That would be good. You should hopefully hear soon. I'm going to stop sharing my screen.
Yes, just give me about 2 minutes or less.
Give us about 2 minutes and we'll have the breakout sessions Um, you just bear with us, you know how Zoom technology goes. Do I need to do anything, Katrina?
No, you're fine.
Okay. I believe everybody went to a breakout room.
Now, Cindy,
Yes.
we ended up, I think we have 8 or 9 people left. So I just did 2 rooms.
Yeah, that's fine.
Okay.
That's fine. I'm not in a room, am I?
You are not, it didn't put you on there.
What's that?
It didn't put you in a room.
Okay,
so you
good.
can just join whichever room.
Oh, I think I'll just let them have at it. Did you set it to close for 10 minutes?
I did not.
Okay, well, let's just watch the clock here.
All right. Maggie, if you can accept the room assignment, then you'll be able to join the breakout room.
We'll give them we'll just watch the clock for about 5 or 10 minutes. That'll work, right, Katrina?
Yes.
Okay. Maggie, if you can hear us, if you'll just accept the invitation to the breakout room, that'll take you right to your room. Maggie, if you can hear us, if you'll accept the invitation to the breakout room, you'll be automatically sent there.
She might have stepped away.
Yeah, that's why I said it again. Maybe I'll send a chat to everyone. There she goes.
Whenever, do you want to give them like a 5-minute warning? Because I can put a message in, broadcast a message to everybody in the rooms whenever you want me to.
How about at about 12:40? I'm thinking with two groups, we probably only need about 10 minutes.
Okay.
Don't you think? So like,
Depends on how this discussion is going.
what do you think?
So it's over at 1. How much time did you need to wrap up the webinar?
I don't need a lot of time to wrap up. I mean, I just want them to share what they talked about.
Oh, yeah.
So
Okay.
that's what I'm thinking, like 1:45 now. If we have them come back in a minute or two, 1 to 2 minutes from now,
Okay.
can you set it to close thing to, for 2 minutes from now?
Okay.
And then that way we'll get everybody back and then everybody can share for a few minutes. What do you think?
Yeah. So I'll let them know that 2 minutes are remaining.
Yeah, don't you think?
Mm-hmm.
Okay. I'm going to share my screen again.
Okay.
And Katrina, they'll all just pop back in. Is that how it'll work?
Mm-hmm.
Just let me know if you can't, just give me a heads up and say, okay, everybody's back from the breakout room.
Okay.
Okay.
All right. Bringing them back in.
Everybody back?
Not yet.
Okay.
It'll close in a couple seconds.
Oh, I got 51 seconds. Okay, I think everybody's starting to come back. It's great.
The Penny group is back.
The Penny group is back. It is, you're right. But the other ones will have to be back in about 3 seconds. Okay. I think everybody's back.
Yes, everybody is back.
All right, great. Well, welcome back from your breakout groups. So I want to take a few minutes for the people who were there and networked together and talked and just to share some of the discussion that y'all had. And so I'll let Penny, since you're the Penny group, if you can, unless somebody has a strong desire to share, we can let Penny report, if that's okay. But feel free to unmute yourself and share if you wish, because we have a few minutes for people to share and to ask questions.
I think Pam did a really good job of explaining this.
All right, Pam, you're up.
I was impressed. I mean, I didn't think of it that way. There's a,
Yeah, I think certainly there were two sides to it, as the impact of a navigator role was that we talked about the additional stress to families who, couldn't, the ever-changing rules of whether you can accompany a patient to the surgical center or to their appointments, or you were relegated to the car, or or at one point more than one could come, or now we can't, now no one can come, and just the additional stress of having to support those patients as their family members were going into treatments and surgeries and all, without them being able to be at the bedside or even in the facility, was kind of one of the emphasis. The other being that some stress to us was also redeployment and having to be away from our regular roles and our regular patients to assist somewhere else in the facility, and the increased stress not only to the navigator, but to not being readily available to your patients because you're in another area of the hospital helping out. I think those were our two main areas of concern. We talked a little bit about, I think all of the facilities, all of the systems are doing their best to support their staff, to provide opportunities to learn more about self-care. I know our nurse navigator competency last year focused on COVID options and having to switch over to telemeds and things like that, plus a self-care component. So I know, with all of the navigator organizations, it's a constant availability of that information, which is great. The recognition of our need for self-care. But I think despite all of that, the consensus is, now that we're looking at this being an endemic, something that may always be part of our lives now, that everybody's doing what they can to take care of themselves, but there's just ever going to be this underlying current that says, I've got to, keep myself safe. I've got to keep my patients safe. I've got to keep my family safe as I may be exposed to COVID. And that's just an underlying current. It's like just something, it's like when you put your mask on to come into work, it's just that underlying current that's always going to present, a level of discomfort or stress that you deal with on a daily basis.
And there's definite evidence out there to support the importance of self-care during this stressful time. So you're already dealing with a patient and their family during their very stressful time, and you're having to help calm them down and help them work through that. And on top of that, we have the COVID situation, and there's evidence to support that navigators have, increased stress and need to, improve their coping skills and need to continue to take a break at work and, feel better about things, be more relaxed. And that actually improves your work environment and it makes it more of a safe work environment too. So this is why we're doing this today, to give you some of those tools. What else? What about from the other group, Amy or Ines or whoever was in your group? Did y'all have any other discussion or talk about anything? You have to unmute. Ines, you have to unmute. Sorry.
We were 4 people. One person was on the phone and couldn't unmute herself. So it was basically 3 of us talking. And Kim Higgins shared with us how through the COVID crisis, she kept thinking of all kinds of new ways, creating new opportunities on how to serve her patients, serve her clients. and become also a role model at the same time for her young child. So I think this was very important and very empowering, very self-empowering what she did, rather than feeling like a victim of, wow, me, what can I do? She instead took the opportunity and thought of creative new ways of doing things. And while that was sometimes not very easy for her, at the same time, she was totally engaged. And one thing that I loved was that her child shared a sense of gratitude for COVID. And she asked, well, what are you so grateful for? And he said, because I get to share more time with my family. So that was quite powerful. Do you have anything else that you wanted to say? I'll see. Amy.
Or Lisa Bridges or Amy.
Amy's gone.
You have to unmute, Amy. Amy, you have to unmute. Sorry.
Okay, I'm sorry.
Sorry.
Kim didn't really want to share. She said she gets a little nervous. She's not kind of out there like all of the rest of us tend to be sometimes. But I think that you were able to sum that up very well. And I think for all of us, we've been facing something that we've never experienced before, and we've all gone through a lot of different things, I'm sure, in our careers. And we've never had to face a situation like what's been going on for the last few years, where we might have been put into a different department, where we might have been pulled in different directions, and where our patients probably need us more than ever before. And that's why I think it's added stress to the navigators, it's added stress to our patients. And we have to find time for our own self-care, but then we also have to find the right ways to reach them by using some of the questions that were given to us today to help them be able to express their fears and not keep it all bottled up. So
Definitely.
I think that everybody's really been able to express that very well.
That's great. Sounds like y'all had some good discussion there. In the couple minutes we have left, and if anybody thinks of a question that they want to ask, feel free. But I wanted to remind people that you'll be getting an email with a link to a survey to complete, and that way and when you get that survey done, you'll automatically get your certificate of attendance for your contact hour. Our next CPNG webinar is scheduled for May, but again, like I said earlier when we first started, this is a quarterly webinar for the CPNG navigators, and we want to hear from you about what those topics are. And fortunately for this group, we now have 2 co-leaders for CPNG, and that is Amy Hoke and Penny Daugherty. So we're all going to be working together to make this the best group for the navigators across the state of Georgia and make it work for y'all. We also, as part of that, we're going to be, just a heads up to come, is we're working on a CPNG listserv in Microsoft Teams. And so Kim Higgins actually is in the pilot group. And if anybody's interested in being in this pilot group, that we're going to work out all the kinks before we put it out to the whole membership. Just send me your email and I'll be glad to add you to the list, because I want to have a place where navigators can ask a question to other navigators and say, hey, what did you do for this? Or I need a resource on that. Or, I'm having trouble with this. Just a quick and easy way to get that information. So please let me know if you're interested in that. And I've also provided the speaker's email here in case y'all want to reach out to them directly. But we only have like a minute or two. Well, we have a minute. But anyways, if anybody has any questions or last thoughts, or Ines, if you have a last visualization we should do to help us maintain our Zen mode, anything?
I would just love to know by how many points people increase their sense of relaxation. I think I would just love to know.
Okay, so 10 is very relaxed and 0 is no relaxed?
Yeah.
So quickly unmute yourself and just give her a number. I'll say I was 10.
I was 10 too.
That's a nice 10.
I felt like a 10. I think we're all 10s.
You were very effective, Ines.
Well, thank you, Cindy.
All right, well, I'm going to stop sharing the screen, and unless anybody has any questions or anything like that, we're going to go ahead and end the webinar, and y'all just be looking out for the email with the survey, and you'll get your certificate of attendance. So y'all have a great rest of the day.
And
Okay.
Thank you.
Thank you for
Thank you.
coming.
Thank you, Cindy, for organizing this all.
Yes, please.
All right. Bye-bye.
Yep.